Welcome to this webinar. Today we're going to talk about the why, how, and when of health economics in diagnostics. My name is Lisa van Engelshoven. I will be your host during this webinar. Today we would like to discuss the role of health economics in diagnostics. And we want to discuss why health economics is valuable, how health economics is performed, and when in the product cycle of a diagnostic test it can be used. With this webinar, we hope to stimulate a discussion about the value of diagnostics and to improve the uptake of valuable diagnostic tests in clinical practice. We would like to ask you to post your questions in the chat box, and we will discuss them after the Q&A session. Sorry. We will record this session, so if you would like to watch this back later, you can. So today we are joined by two experts in the field, Dr. Geert Frederiks and Dr. Tim Grovers. We will start off with a presentation for Dr. Geert Frederiks. Geert is an associate professor in health technology assessment at University Medical Center Utrecht in the Netherlands. Since recently, he combines this function with an applied professor of digitalization revalidation care in the Han University of Applied Sciences. He was involved in many studies around the value of diagnostics, especially in genomic sequencing. I will start up your presentation.
Yes, there is. Thank you. Thank you for this very nice introduction, and thank you for having me here. So my name is Geert Frederiks, and as outlined, I'm an associate professor in health technology assessment and an applied professor in digital transformation in rehabilitation care. But I want to discuss today with you the why, how, and when of health economics in diagnostics. And I'm very happy that I was asked to give this, to be part of this seminar. If you are getting old, this list often is getting longer and longer, but I always say that I started off as being a medical biologist. So I did my study for a few years ago in medical biology and then jumped into health technology assessment. I was until recently the head of the health technology assessment department at the UMC Utrecht, and currently still working there as an associate professor. Who am I? This is me in my working relation, but I also like to travel on my bike and go out for long travels and enjoy holidays with my family. I thought, apart from who am I, it's good for you to know who is talking to you and what is his link with diagnostics. Over the past few years, I had a few PhD students working on, I see PowerPoint is not visible as a chat in the chat. I worked on topics, oh, it is. Okay. I worked on topics like added value of whole genome sequencing in oncology and in children with rare diseases. We calculated the micro costing of whole genome sequencing and worked on a lot of different value dossiers for diagnostics. Apart from that, it's good to know that I'm a member of GEECS, which is the Global Economics and Evaluation of Clinical Genomics Sequencing Working Group. Now, it's always a very long abbreviation. So I did a lot in assessing added value of diagnostics. And I would like to share some of the experiences, some of the learnings. But I want to start with the take-home message. And the take-home messages begin at the end. So always keep in mind, where do you want to go? And who do you want to convince with your value dossier? I want to stress that it's not only about health economics, although health economics is an essential part of your value dossier and about convincing stakeholders. It's not the only thing. And we need to look broader into the value and start early. I think that's one of the key messages I would like to give is it's often too late, and you can better start early with building up your value dossier and looking into added value and even in potential value of your diagnostic. And keep in mind stakeholders. So keep in mind who you want to convince and what are their needs and what do they would like to see. Why are we doing this? So why health economics? And I can be very clear about that. It's looking into added value and looking into what do you add for patients, for the laboratories, and what does it cost? And what do you want to add and how much do you want to pay for it? It's something, and I often start off with this slide, something we do like on a day-to-day basis in our own lives. If we want to buy a new iPhone, we think about its added value for ourselves. How much do we pay and what do we get back from it? And we should think about that when we look into the diagnostics we are studying as well. What does it add? What does it add for the people who are going to use it? And how much does it cost? So we want to gain insight in this added value, as it is crucial for these decision makers. And we should stress that health economics combines impact on both costs and effects, and is often seen as two major criteria for decision making. How do we do that? So we should outline that health economics is part of health technology assessment. And in health technology assessment, we are looking into the added value of innovations in decision making and for society in general. And maybe a few of you are aware of the latest definition of HTA, seeing it as a multidisciplinary process that uses explicit methods to determine the value of a health technology at different points in its life cycle. And the purpose is to inform decision making in order to promote equitable, efficient, and high quality health systems. And this is the definition we should keep in mind if we want to address added value of diagnostic technologies as well. And in this definition, a lot is in its life cycle, inform, decision making, and efficient and high quality. And I think that is what we try to do with value dossiers and with looking into added value of diagnostics in general. So cost effectiveness and health economics, and as I already mentioned, maybe a lot of you are already aware of this definition, is something in which we try to link the costs and effects of the new and the old strategy with each other. We want to gain insight in how much do we pay and what do we get back from it. And it informs reimbursement decisions at reimbursement authorities. And now we directly come into the how, because we do have quite distinct, clear guidelines on these economic evaluations. If we, for instance, in the Netherlands, look at the guidelines of the Dutch Healthcare Authority, we know how to address and how to perform these economic evaluations. But we do foresee some issues looking into the added value of diagnostics. One of the reasons is that the decisions on diagnostics, the use and implementation, are often not made by the large reimbursement authorities. Often these decisions are made in hospitals, in laboratories, or by managers themselves. But what do we see in the past few years? We do see that a lot of value dossiers are often still focused on the guidelines issued by reimbursement authorities. And in that case, and in that respect, we do not often listen to the stakeholders who do want to see other things, because the decision makers in diagnostics often want to see more than only these incremental cost effectiveness ratios in which we outline added value in terms of costs and effects. What they would like to see is, how do we reach these outcomes? How do we ensure that these costs are really saved? Because from a laboratory perspective, they want to gain insight into their cost saving and want to see how they can monitorize these changes of a new diagnostic. So they want to see intermediate outcomes as well. But also the impact cannot always be measured in the outcomes of the guidelines. And we want to see, for instance, long-term impact, other impact. We want to see impact on future outcomes. And that's something we need to do with other outcome measures as well. So do we have an issue? Do we have a problem? No, we don't have a big problem, because I do believe that we can overcome these issues. Now, one of the reasons is that we should look into the broader insight and added value. And my learnings from the past few years, having done quite some added value assessment and health technology assessment of diagnostics, is that we should come up with other outcome measures as well. apart from cost effectiveness, so I really believe that we should come up with impact on costs and effects, but we should also look into these added values a bit more broader. So what is the impact on professional, on the environment, on the hospital department itself, or on the patient? So if we want to get reimbursed, diagnostics used, we should start with conversations with end users, people who are going to use it and people who are going to pay for it, because they are the ones who really would like to see sometimes additional things of what these evaluations and what these diagnostics bring. So what I have seen is that business cases, so impact on laboratories, impact on changes in laboratories, impact on other costs within the hospitals are essential. So look broader into value, and this is the most easy question. When should we look into the value of these diagnostics in health economics? Early. I really believe that you should start with your value dossier. You should start with assessing added value early in the development process, because we already know which part of the diagnostic process a new innovation is going to be compared with. So we already know a lot about the current way of working. So we can use, for instance, with an early HTA, a room for improvement or a so-called headroom analysis, look into added value and potential added value. And then we can have early discussions with stakeholders about the outcome measures they would like to see, and we can update the model. What we often see is that HTA is used only at the end to evaluate the impact, but we should start with it early, especially in diagnostics. We should start with it early to see what the potential room is and to see how we can change that and maybe go for other patient categories, other departments, other laboratories to see where this added value is the highest. And again, update your outcomes when new evidence comes available. And that is essential because in the case of reimbursement authorities, they often ask for evaluation once. But if you have discussions with people, with stakeholders in the hospital, they want to see this added value more often and in more a sort of a life cycle approach. So what are these learnings? And we have summarized this in two recent papers focusing on genomics. But I do believe that a lot of the learnings are also of interest to a lot of other diagnostics, also companion diagnostics, is that we have to build business cases. We have to think about how diagnostics changes the bigger, entire environment of performing diagnostics. We've seen a lot of diagnostic modalities which change the way laboratories should work. And that's something we should keep in mind as well when coming up with these business cases. Life cycle evidence, that only means that you should update your value dossiers and your models. So be in close contact with those who are using your diagnostic modality and try to get data out of these systems to constantly update models to further pinpoint added value, evaluate at the right moments in time, and come up with uniform and transparent methodology. The below three, evaluation, life cycle evidence, and business cases, are of extreme interest, I believe, to also for companies. The uniform and transparent methodology is something I often get very happy about, because I do believe that we should come up and strive for more uniform and transparent methodology so we can compare things. We can compare diagnostics and also compare outcomes. So future outlook, I'm looking into the time, and I'm quite into the time, and also because I also look at Tim, we really would like to have the discussion after our presentations with you as well, because we can only send information, but I think the added value is in having those discussions on the topics you are running into. But a future outlook and some, again, take-home messages are start with conversations with end users and decision makers. What do they want to see? So don't stick to the current guidance, which is issued by healthcare authorities and which is put on medicines, because diagnostics often ask for other aspects as well. Build a broad value dossier outlining impact of your diagnostic innovation on other and intermediate outcome measures, and show your impact. Show your impact in figures, in outcomes, and try to have that discussion with these end users, how this impact can reach out into win-win situations for both. So one of the main lessons I have learned in the last few years is that we always have to search for win-win situations. So a win situation for company and a win situation for hospital or laboratory. I have seen also with regard to the implementation of genomics that it takes time and it takes too long already because we are looking into the wrong outcome measures. We are having discussions in which we don't have win-win situation, but win-lose situations. So in this case, laboratory does not want to change. And for them, they feel it as a lose. And then implementation does not reach the end goal that you want to reach. So search for win-win situations. How can we ensure that everybody is happy when reimbursing or using innovative diagnostics? So I would like to thank you, but directly would like to give the word, I think, or to you. Yeah. I would already say this, but first to you, and then we go on. So thank you, and
yes,
back to
so
you.
Much. Small introduction. We would like to continue with Dr. Tim Govers, who is the CEO of Medip Analytics. Tim has a PhD in the use of simulation models to make healthcare decisions for both the population and individual patients. He helped many biotech and medtech companies to show the added value of their diagnostic products in different countries. And I will start up your presentation.
Great. Yeah,
the floor is yours.
Thank you very much. So I want to add to what Geert already mentioned by telling about what we call dynamic value analysis using health economic software. And we at Medip Analytics believe that this already can overcome a lot of the issues that were nicely mentioned by Geert. So I will take you on that journey looking to this dynamic value analysis. But first, also a small introduction from my side. So I worked for about 10 years at the Radboud University Medical Center in Nijmegen in the Netherlands, working on health technology assessment, a lot of cost effectiveness analysis to different products. So during that time, I worked on about 50 different products, among which a lot of diagnostic products. And also my story today will be based on the experience I got working on these diagnostic products. And now I'm working as the CEO at Medip Analytics, and I'm also one of the co-founders of Medip Analytics. And I want to tell my story based on a fictional company called BDX, and work based on the case of BDX on how we believe that you should work with health economics for diagnostic products. So historically, what we saw a lot is that diagnostic companies, of course, worked a lot on product development for their diagnostic product, then did diagnostic studies looking at the diagnostic accuracy of their products, and with this diagnostic accuracy studies going to the stakeholders to convince them about the added value of their product. But then often we see that they more and more got asked about their health economic impact, or the impact on value beyond diagnostic accuracy, actually. And that's where we come in. And we did that a lot for different companies. And what you see then often is that with these health economic studies, you start and you have to actually focus on one specific setting. So starting from the Dutch perspective, looking at how they work in current practice in the Netherlands, working from a few example hospitals, and then also use the cost levels from, for instance, a specific country or a specific hospital. And then, of course, it worked nicely in the discussion with the stakeholders that are in that context. But then actually, we experienced a lot of problems. Like in this case of BDX, they also wanted to use this health economic outcomes to different stakeholders. But then they saw that they got a problem because these stakeholders mentioned, yeah, it's nice that you have shown that you are cost effective in the Netherlands with that specific pathways that you used and those certain cost levels. But yeah, we are, for instance, here in the US, we have a different pathway that we are using. We make different decisions. And of course, we have different cost levels. So those health economics often did not match this context of the stakeholders, and the stakeholders were not convinced by these value assessments. And also problems that we saw working on these health economic studies is that, often these companies do not perform one diagnostic study to their product and work from their diagnostic accuracy then. But then they do more and more studies over time with different populations, different countries. And actually, they asked us, okay, can you do the health economics again? And we have to sort of start over and work from this new study data, which they then can use again to discuss it with the stakeholders. But yeah, it of course takes a lot of time to do it again. And then also what we see a lot is that then the product develops over time. So there is a new version of the product with different characteristics. Then they had to perform the diagnostic studies again, but also the health economics change with this new development. So then you see that it will add up over time and you have to do a lot of new assessments. So actually, yeah, what we believe is that it's really important to assess the health economic impact within the context of use. So like Geert already mentioned, yeah, it's very important to look at the perspective from the stakeholders. So we also believe that you then should do the value assessment within that context of use and be in that way, be more aligned with what the stakeholder wants to see. And also important that you think about assessing the health economic impact, that things will change over time. So your product will change over time, but also the environment or the context will change over time. So current practices will change, but also cost levels will rise. All things that will have impact on your health economic impact and the impact of the value of your test. So yeah, what are those examples of contexts that change in different settings? So I have obtained some different examples. If I think that you can see that things vary a lot in different contexts, will have big influences on the value of your diagnostic test. So on the left upper side, you see the difference in how many patients were screened for colorectal cancer. And you see a lot of big differences between European countries even. So if you have, for instance, a test in colorectal cancer diagnostics, the country where you will work in will change a lot also with your value. And you have to think about that. On the right upper side, you see a change in MRI use for prostate cancer detection over a few years, and you see big differences in the uptake of MRI within those regions. So also when you have a diagnostic test in prostate cancer, the setting that you are working in and the uptake of MRI there will have big influences on the value of your test. So these are all things that we believe are very important for your value assessments. Here you see different cost levels between countries, referred to as the percentage of the price compared to the US price. And also here for different treatments, you see a lot of big variation in cost. So when you are going to different countries, but also different settings within countries, these cost difference will be really big and also will influence your cost effectiveness as well. And on this graph, you see the inflation for different products, with a really big inflation for hospital services. This is an example from within the US, but I think we know that actually in a lot of different countries, inflation was really high in the last few years. And this will also have an impact on the health economics of your product. So at Medip Analytics, we truly believe in this dynamic value assessments, and therefore we developed our health economic software. And with this software, we believe that you can show the right value for the right stakeholder at the right time. So taking into account the context of use, but also that you are able to update your value dossier, how you call it, over time. And this is used by biotech and medtech companies to show this added value specifically to this stakeholder, so doctors, hospital managers, and payers. And we believe that that we should make it intuitive how this value comes up. So also what Geert mentioned, I think is really important, that you show not only the final outcomes, this is the impact on cost and quality of life and health impact for patients, but also how we come to those differences and show the road to this value actually. And also what we want to do with this health economic software is that you are always up to date, so that you can take into account your newest diagnostic studies. If something changes in the context, that you easily can adapt it to that context. So during this presentation, we of course not able to show the full demo of our platform, but we still want to show an example of how such a dynamic analysis, and in this case, of course, within our software, can make an impact on the value of a diagnostic test. And in this case, we use an evaluation for a prostate cancer diagnostic test, where we change a thing in the context of use, and we will see how that will impact the cost effectiveness of this test, the value assessment. So here we have a short video where we show our platform. And in this video, we are going to show what's the impact of different context of use if you look at the value of a specific test. So in this software, we compare the standard of care to a situation where a new test is used. In this case, it's called test X. And in our software, you can then look at, okay, how does current practice looks like, the standard of care, and how will the test X will be implemented. And in this case, we changed the current practice to doing no biopsy when there is no suspicion on MRI. In the next step, you can also change the population. So if you have population differences between contexts, you can adjust it. In this screen, you can take into account if, for instance, the accuracy of the test changes over time with new versions, for instance. Here we add different consequences, so different cost levels, if you are looking for different countries, for instance. So all these things that I just mentioned are included in this dynamic analysis. And also the difference in oncological outcomes, in this case, if you find or miss a cancer, can be taken into account. But for now, what we wanted to show is now we have included a specific setting. And in the software, we simulate these pathways and look at what are the outcomes then. And keep in mind that we now have almost $1,300 in cost savings and 0.02 quality gains of this diagnostic test. But now we change the setting. So in this way, we are going to say that patients with an unsuspicious MRI will not get or do get biopsied in this case. So it seems like a small difference, but actually you see now that your value assessment changes a lot. So the cost savings and the quality gains almost double. So these kind of differences, which are a lot in current practice, will make a big difference on your value assessment. So that's actually an example of that we wanted to see. And then I wanted to say also something about the different outcomes that we want to assess, because Geert already mentioned that it's not only about cost and health outcomes. So also we believe that it's very important to look at other important outcomes, and what we believe in, what are important factors to take into account in our value assessments is the time spent by healthcare professionals. So if you include a new diagnostic test, how will that change the total time spent of healthcare professionals throughout the pathway? And an important part that we believe is getting more and more important is also to look at environmental impact. So if you change something in the diagnostic workup, we believe that it can have a big influences on, treatments will change, but that therefore it will have a lot of consequences also on how many often patients have to travel, how many treatments are given with all kind of disposables, things like that. So it can have a great impact on environmental aspects as well. So that will be an important one to add, what we are also working on. But actually for the Q&A session, I was also very curious about maybe things that you come across when discussing the value of your diagnostic test with stakeholders. So what kind of outcomes did they ask about that we did not mention yet? So I thought that would be a nice discussion point for the Q&A. And actually that was my presentation for now. So I hope that there will come some questions for me or for Geert or both, so that we can also have a discussion on that.
Yes, thank you so much for both your insights. As Tim already mentioned, the Q&A session is now open. You can either post them in the Q&A section of the Teams link, but you can also raise your hand using the button, and then we will unmute your microphone, and then you will have the floor. Do you see the questions?
I think there are some questions in the chat, right? So I can click on the chat.
Oh, there we go.
So there's a question: what do you think is the main difference with the pharma medtech health economics compared to diagnostics? So maybe you want to start with that here.
Yeah,
your thoughts.
The main difference is what we mentioned is that there are of course a lot of similarities in the way we address it. I think the main difference is often in the way we should think about extrapolation of short-term outcomes. If you look into diagnostics, a lot of diagnostics is often used also as some sort of a prevention, and you don't know yet what you are going to prevent in the near future. So you have to build like models which do have quite some uncertainty with regard to future outcomes. I think that's one of the biggest differences for diagnostics compared to pharma and medtech, is the extrapolation of future impact. Yeah.
So I also would place medtech more closely to diagnostics, right? And then there is a difference with pharma mostly, in my belief. And what I've seen in what I've done in the past, but also what we are doing now, is that in diagnostics, I believe that variation in the context of use is even more important than with medication. So for medication, you have of course a lot of difference in population, but you often work in your health technology assessments from one or two main studies. But in diagnostics, there are so many factors that play a role. So what kind of place does that diagnostic has in the total diagnostic workup? And all those combinations with different other diagnostic modalities play a role, and you have to take it into account. And I think that's also a main difference. But
but I think I think you will definitely agree with that, Tim, is that and maybe that adds up to what you mentioned as well. One of the big difference also is the fact that it differs per laboratory often and per hospital. So the way the makeup is done, the way the things are done, and you need to change that within the system you are looking at. And the system is not only, as you mentioned, countries, but sometimes the system is even a bit smaller, and it's a laboratory which is differs from other laboratories with regard to the diagnostic flow, the time spent, and I think that's sometimes also essential to grasp that in your evaluations.
Yeah.
But I see also, could you elaborate on cost savings? For who is this important? Which is an interesting question due to the fact that also that changes a bit, but I can give my Dutch perspective on that. If you look into the way hospitals are financed, in the hospital, there's always a discussion with the board of directors in how much money do they get per different department from the board of directors. So we now see a lot of discussions on board of directors who need to cut costs a little bit. But then it comes into play that you have some cost savings due to your improvement in diagnostics. And then that as people in managerial functions can use that to convince board of directors to invest, for instance, in new diagnostics, due to the fact that they can maybe spend their money somewhere else in the hospital. So that's,
And I think also these cost savings that you can show are sometimes even important within the, I think you also already mentioned it in your presentation, that it's also important, where are these cost savings coming from? Is it from more the diagnostic part or the treatment part, or even within the diagnostics, what do you reduce? So if you reduce MRI, that will have an impact on the radiology department. But if you will reduce the number of blood tests, that will have an impact on the laboratory department. So I think it's crucial to get insights in where these cost savings come from, so that this discussion can take place between these departments as well.
Yeah, no, fully agree. But this is often also quite a difficult discussion, to be very honest, because, and I've seen that also with whole genome sequencing. If you are really, really honest, sometimes you have diagnostics which really change the setting and the place and everything. So some diagnostic modalities do have such a kind of large impact that maybe entire laboratories should change. And maybe even people working in laboratories in hospitals should maybe do something else in the hospital. And I mean, I know that sounds quite a bit strange to them, but sometimes you can automatically make your flow due to a new diagnostic modality so automatically that you don't need this amount of people working within your lab anymore. And we do need, from a hospital perspective, we do need people in a lot of other places in the hospital. So that's maybe a large discussion.
I think it's also interesting with this time aspect. So looking at the change in time that you are working on things. And you have to also weigh that against different cost changes, of course. So I think all those 4 pillars will be really important.
Yeah, and I think that's also with regard to, maybe we try to make the bridge to the following question: time saving. What will the people do with this extra time? Drink a cup of coffee. And in general, I believe that the added value of innovations, it's not the innovation itself which has the added value. It's the added value is in that what you do with the time you get back, and with the time or the money you save, you need to do something properly with that, because if you don't do anything with that, I mean, your innovation doesn't have added value. And I think the extra time is, I mean, if you talk about the impact on the healthcare professional, maybe a healthcare professional or maybe somebody in the laboratory has a bit more time to drink that cup of coffee, because you hear that the working pressure is so high. Maybe sometimes the added value is in having some time for yourself at work. And that's again, that macro discussion is, if you save a lot of time, maybe you can be a bit smaller with regard to your number of FTEs in your laboratory.
I agree. So I think it will have a big value if you can show that healthcare professionals will have a bit more time to do stuff like drinking a cup of coffee or talking to their colleagues and things like that. So I think that's also a really important outcome measure to look at this time, even without if we can immediately say that this time will be spent on this other treatment or this other thing that they do. So yeah.
No, yeah, and I think, and we haven't discussed that a bit, I think, but I think apart from, I think health economics and costs and effects are essential to convince people and convince stakeholders. But I think, I mean, speaking from a perspective of a company, I think getting the people who are going to use it ready for use is also essential, because if they are not like ready to use a new diagnostic modality or not happy with it, I mean, it can decrease costs with a huge amount, but then they still not use it. So I think that's also something to,
So we have another question. Do you think hospitals have better sources of realizing ROI from AI as compared to high OPEX, but more popular radiology AI solutions?
I have to read this question again. Do you think better sources of realizing return on investment from AI as compared to high OPEX but more popular radiology? Maybe that person asking this question can elaborate on this a bit. You seem means with this question.
I see a lot of typing happening.
Yeah. Departments. Looking at some extra coming up. So maybe the person explaining the question a bit further can come back to the environmental impact. So how does the software intend to assess environmental impact for the life cycle of a health technology? Yeah, so we're working hard on that. So what we are doing is that for each diagnostic modality or treatment, we want to come up with the CO2 equivalent and to see, okay, what if we take that into account? How would these diagnostic and treatment modalities change over time? And also, what would be the impact on the CO2 there? And there are some nice examples of calculators which are out there, and we are going to use them to also make sure that it's very flexible and dynamic. So if something's changed with the number of disposables, for instance, that are used over time, then that's something that we want to take into account, that, then also the environmental impact changes over time. So we also still believe that also in that aspect, it's really flexible and dynamic. Okay, this is, thank you very much for the clarification. So this asked, is radiology AI difficult to prove return on investment as compared to simple interventions like patient scheduling, transcriptions, and assignment of resources? That's a nice question. I think it depends a bit on the purpose of this AI system. So is it something that improves the diagnostic accuracy of the imaging technology, or is it something that speeds up the imaging and the reading of the images? I think when it changes diagnostic accuracy, it's actually quite similar to what we do with, for instance, IVD tests. So then you look at, okay, what would be the impact if you improve diagnostic accuracy? How will that improve treatment? How will that gain impact for patients? And what does it do on the costs during that whole pathway? But when it's only speeding up things, then I think it's getting sometimes a bit more complex. And then I think the other questions that are asked comes into play. So then often what is asked is, can we monetize this reduction in cost? Is it something that we can reduce the number of people that we have working here? And then you come into those different questions that we already touched on a bit before. But I think still, yeah, that also if you can show to radiologists that they have more time for other stuff, that will be very valuable. And that sometimes I think it's not even needed then that you really quantify it in monetary terms, but that it's an outcome on its own that you can be more quick with your readings actually. I don't know if you have any.
No. I think it's addressing added value becomes a bit more complex when there is not a direct causal relation, if you know what I mean. If if it's, I mean, it gets a bit more complicated due to the fact that you have to take into account like the cascades of what happens to a patient afterwards, and of course like patient scheduling, assignment of resources is a bit more like direct impact. You see the impact directly instead of the impact like further on in the patient journey. I think that's I think with diagnostics it's often similar as with a lot of prevention discussions. You pay now, but you have your gains in a later stage, and that's often I mean.
Yeah, maybe sometimes as a health economist, I see it then the other way around, like I just mentioned, because I like it when we have something that we can translate into added value with respect to qualities and cost and things like that. But when, for us, that's maybe a more easy part because we are used to it. But when it are really the simple, small things, then sometimes I find it difficult because, then it's hard to translate it into really tangible stuff. Like if you gain 5 minutes with a reading, what is that worth? That's difficult, I think.
I agree, but that's what I mentioned also with this win-win situation is if what we often see also with diagnostics is that a hospital pays, but where are the gains? Are the gains for the hospital or are the gains somewhere else? I mean, we had a discussion in another hospital with regard to that one department needs to pay for an additional diagnostic test. They had to pay for it, but the other department had got the gains because or the savings. But how do you, I mean, that's something you have to gain insight in as well. Some sort of a follow the money, I think is, but I saw the question of Stan as well. What are other items you would like to see? I think I missed one a little bit, and that maybe is something you can get into your into the app as well. Nice. I think equity. So is everybody able to get like to get into these diagnostics? Is everybody able to get them? I think it's also something which is quite differing even within countries and within laboratories. I think. I mean, one laboratory uses this or the other laboratory uses that, or I mean, that's also I think equity.
That's a good one. And we should think hard about how to include that.
No, that's a good. I'm just the scientist who wants to include this, but it's I think
that's a nice adding. I don't see any more questions coming up, so I think
yes. So keep in mind that this was all recording, so you can always watch it back or ask any more questions to any of the Medip staff. Thank you all for your participation and engagement. You can always contact us if you have any more questions. Our doors also always open. And hopefully until next time, take care and have a great evening.
Thanks a lot. Thank you.
Thank you.